Good day, everyone. Today, we present to you our research study entitled Under Pressure, Life with Hypertension Among Community Residents, a qualitative study aimed at exploring the lived experiences of hypertensive individuals in a rural community setting. Hypertension remained a critical global health issue, with over 1.28 billion adults affected worldwide, most of whom lived in low and middle income countries. Despite the availability of treatments, barriers such as low awareness and treatment non-adherence continued to contribute to high morbidity. Our study was rooted in the community of Purok Punta Balas North, Bacolod City, where hypertension posed significant health challenges. Through this research, we sought to understand how individuals navigated the complexities of hypertension in their daily lives, shedding light on their physical, psychological, and social well-being.
The study's statement of the problem aimed to explore the lived experience of hypertensive residents in the community.
For the significance of the study, our findings aim to benefit the following key stakeholders: City Health Department, barangay officials, community health nurses and barangay health workers, educational institution, residents, and lastly, the future researchers.
Our research used Nola Pender's health promotion model to explore how beliefs and behaviors influence health practices, focusing on motivations and barriers of hypertensive individuals.
The conceptual framework combined theories on individual traits, health behaviors, and environmental factors. Guided by Nola Pender's health promotion model, it emphasized how perceived barriers, self-efficacy, and social support affect behaviors like medication adherence and lifestyle changes.
For our methodology, we used a qualitative phenomenological design to deeply explore participants' lived experiences, focusing on their perceptions, beliefs, and barriers to provide a comprehensive understanding of life with hypertension.
Using purposive sampling, we selected 8 hypertensive individuals aged 40 to 65 from Purok Punta Balas North. They were CHN exposure contacts of level 3 nursing students diagnosed with hypertension with a BP of or above 140 over 90 mmHg and on prescribed medication. Individuals with severe comorbidities or cognitive impairments were excluded to ensure meaningful input.
Semi-structured were the main data collection method, covering the daily activities, health behaviors, psychosocial well-being, and community influences, conducted in Hiligaynon through openness and later translated. The interviews followed the validated guide with an open-ended questions, like how does hypertension affect your daily life and health management?
The researchers used the modified VANCAM method by Mustakas for thematic analysis, systematically coding data for identifying key themes. Textual and structural descriptions captured what the participants experienced and how they interpreted these experiences into their social and cultural contexts.
Data gathering began with technical and ethical approvals, validation of the interview guide, and community permissions. Participants were purposefully selected and verified through health records. Home visits were made for consent and private recorded interviews. Data collection occurred from February to March of 2025, with analysis using the modified VANCAM model.
Ethical considerations were prioritized with approvals from the Ethical Review Board and community authorities. Informed consent highlighted voluntary participation, autonomy, and confidentiality. Principles of beneficence, non-maleficence, and justice were observed, and data handling complied with the Data Privacy Act of 2012.
The next section of the study is results and discussion, starting with the demographic data, which includes age, sex, genetic predisposition, and socioeconomic status. The first participant was pseudo-named as John, the second participant was pseudo-named as William, the third participant was pseudo-named as Corey, and the fourth participant was pseudo-named as Andrea.
The 5th participant was pseudo-named as David, the 6th participant was pseudo-named as William, the 7th participant was pseudo-named as Danica, and the 8th participant was pseudo-named as Anton.
For Theme 1, we focused on the knowledge and health beliefs of hypertensive residents. Participants shared different causes they believed triggered their condition, like salty food, instant coffee, overwork, stress, lack of sleep, and even exposure to sunlight. Some pointed to lifestyle factors such as smoking and alcohol, while others believed it was hereditary. These personal experiences show how cultural and social context shape their understanding of hypertension, which reflects the health belief model's idea that our beliefs influence our health behaviors. For Theme 1, we focused on the knowledge and health beliefs of hypertensive residents. Participants shared different causes they believed triggered their condition, like salty food, instant coffee, overwork, stress, lack of sleep, and even exposure to sunlight. Some pointed to lifestyle factors such as smoking and alcohol, while others believed it was hereditary. These personal experiences show how cultural and social context shape their understanding of hypertension, which reflects the health belief model's idea that our beliefs influence our health behaviors. Flashed on the screen are the significant statements from our participants of the study that aligns with our theme.
For the second theme discovered in this study, hypertension impacts daily activities and cognitive functions, causing fatigue, mental distress, and reduced independence. In the Philippines, hypertension-related deaths rise due to the limited awareness, poor surveillance, and low treatment adherence. Effective management requires lifestyle changes, physical adjustment, dietary modification, and strict medication adherence. Significant statement includes in these themes are flashed in the screen.
The third theme focuses on the role of family and social networks in the management of hypertension, revealing how familial support, communication, and cultural practices shape their health-related decisions. Additionally, this theme delved into the influences of family norms and expectations on treatment adherence and healthcare utilization. The theme was further divided into two sub-themes: 3A, impact on family dynamics and caregiving roles, and 3B, shifts in family roles and strain. Significant statements under this theme and sub-themes are presented on the screen.
The final theme, engagement with barangay health services, highlighted participants' experiences with accessing and using primary health care in their community. Engagement was generally limited and inconsistent, with many preferring private providers for perceived better care. Barriers to using community services included limited medicine availability, long waiting times, and inconsistent follow-up. Significant statements include:
To conclude this study explored social demographic and community factors influencing hypertension management, revealing the biological, cultural, and social factors significantly shape the residents' lived experiences. The findings highlighted that effective management requires comprehensive lifestyle changes, strong social support, and improvements in healthcare delivery.
The findings and conclusion of the study implied some recommendations that can be addressed to the involved stakeholders. Nurses should apply a culturally sensitive, patient-centered approach with strong communication and advocacy. Family and community support must be strengthened through bayanihan initiatives.
City Health must boost barangay healthcare with consistent supplies, mobile clinics, and NGO partnerships. Barangay officials should enhance health programs, staffing, and education efforts.
Lastly, barangay health workers need further training in hypertension care and home visits. Residents are urged to engage in health programs and lifestyle changes, and future research should explore younger patients, gender barriers, alternative medicine beliefs, and family-based interventions.
And finally, the researchers wish to express their deepest gratitude to their esteemed research advisors, Dr. Sheilla M. Trajera, RN, MN, LPT, PhD, Dr. Glenn E. Dolendo, RN, MAN, PhD, and Dr. Mary Beth P. Diva, RN, MN, PhD, for their unwavering guidance, invaluable wisdom, and steadfast support throughout the course of this study. The researchers are also sincerely thankful to their colleagues and friends whose encouragement, insightful perspectives, and motivating words provided continuous inspiration during challenging moments. Furthermore, heartfelt appreciation is extended to the study participants whose generosity in sharing their experiences and perspectives greatly enriched the findings of this work. Above all, the researchers are profoundly grateful to their families whose endless patience, belief, and unconditional support have been a constant source of strength and perseverance. And that concludes our presentation. Thank you so much for listening.